Alright, so back in the OR today, so we're doing a BBL with arm lipo and lipo 400. So we have our lovely patient here. She's a little bit on the thin side, but if anybody can find the fat, it's always definitely me. So the goal with lipo 400 is to remove all the fat from the bottom of the breast all the way down to the pubic area. So that's upper abdomen, lower abdomen, pubic area. And then I always do this area right here, which is kind of the brow roll and axilla. I notice a lot of people get lipo elsewhere and this area is never touched. And that's what makes my lipo 400 different. So I do all this and all of this area here. In addition, I do all of the upper back, the middle back, the lower back, and what we call the sacrum. Once I'm done, you won't see any visible scars. You won't see any scars on the tops of the butt here, on the side, or underneath. All of this is done through discreet, very well hidden incision. For the arms, I always make a tiny incision in the elbows, and that allows me to get all the way around the arm, the back, the sides, and the front. Everybody wants something a little bit different with their buttocks. Obviously, we're here today to add a little bit more volume, add a little bit more hips. I always let the patient decide what's best for them, but my goal is to make sure I deliver the best possible product for her body. What are you hoping to get today?
Tiny waist.
Tiny waist.
Juicy booty.
Juicy booty.
Tiny waist, juicy booty.
Say less, that's what I'm here for. I'm gonna start marking you up. So everybody looks a little different when they're standing up versus when they're laying down. So as surgeons, we make markings just to kind of help us define the anatomy and what we're looking at, especially as we're laying down. Okay, so we'll just go over my markings one more time here. So lipo 400, I'm gonna lipo this area down here, here, and here. We're gonna do some high definition, really bring her abs out. We're gonna lipo kind of this lateral chest, brow roll area, and really help sculpt and bring this waist in all the way to her rib cage. And then I'm going to lipo her lower back here, her middle back, and her upper back, along with contouring to her arms. There's just a tiny incision right there. And then we're going to augment her buttocks here and her hips. We don't want anything that looks crazy. We want something that looks really good. It really stands out, it pops, but it's not something that doesn't match her body. Lucky for her, she has really nice legs. And so her butt, no matter what I do, is going to match her thighs. And so some girls have really small legs and doctors will go put large, butts on them. I don't agree with that. But with her, she has excellent, very, very fit and large thighs overall, so her butt is gonna match perfectly today. So a lot of people ask what determines my BBL outcome, or how is it going to look? A lot of that depends on your baseline anatomy. Some people come in with what's called an A-frame shape, where they have a narrow hip and kind of wider legs. Some people have a V shape, where they have a very wide hip and very narrow legs. Some people have more of a round shape and more of a square shape. The V shape is one of the hardest shapes to work with, and oftentimes it takes 2 rounds to get the best result there. The A-frame, that's one of the easiest. It's really hard to mess up. I've seen it happen with other revision cases, but the A-frame is the best starting point because that's what gives you that upside down heart look. And so your outcome is determined by your own anatomy, but then also your surgeon and their preference on how they remove the fat and put it in. I try to be as aggressive as I safely can by removing as much fat as we safely can, and then we maximize that fat into your butt and your hips. I always let the patients decide what they want to look like. Are they going for a hippie look? Are they going for a high hip, low hip, projection, slope? All those things matter. And so I try to work with the patients to figure out exactly what it is that you want so I can deliver the best product possible. BBL safety is extremely important. You've heard stuff in the news about people dying from BBLs, and we take that very seriously. I've never had any deaths, especially a BBL death. And usually when that happens, when you hear about something like that, it's usually related to fat being injected into the muscle. Inside the muscle, there are very large veins. If you were to incidentally hit one of those veins and tear it, fat can get sucked in and go to your lungs. That is why we do not inject muscle. We always inject above the muscle where it's safe. And we use an ultrasound for that reason, because using an ultrasound makes sure that we are exactly where we need to be above the muscle where it's safe. All right, are we ready for a timeout? All right, we have patient AC, 31-year-old female, here for Vaser Lipo 400, lipo of her arms, and a BBL. She has no known drug allergies, is that correct?
That's correct.
Okay. She's currently supine under general anesthesia. The SCDs are on and working, correct?
Correct.
The underbody and overbody warmer is on and working.
Above and below.
Okay. She was given NSAID.
And it's at 2 grams.
Okay.
And TXR were given 1 minute on arrival to OR.
Excellent. Her HemoQ today is 14.5. The BMI is 22. Any anesthesia concerns?
No anesthesia concerns.
So during liposuction, we always use special fluid. It's called Tumescent fluid. It has epinephrine or adrenaline, and that helps to decrease bleeding during liposuction. And then it has pain medication that helps to keep you comfortable during the procedure, and it also helps to require less medicine to be given by anesthesia, and it makes it more comfortable for you for the first few hours post-op. So it's just a clear fluid, and it's just called Tumescent, and this is how we put it inside the patient here. So it's just fluid that comes out, and that goes inside of you. We put it above the fat, in the fat, and below the fat, and we leave that sitting in the patient for about 15 minutes just to allow it to take maximum effect. So that's what we call tumescent infiltration or tumescent fluid. For all my liposuction cases, I use something called Vaser, V-A-S-E-R. And this is an energy device. It delivers ultrasonic waves at the tip here, and that actually helps to separate the fat from the surrounding tissues. It doesn't tighten skin. It's not a laser, although it sounds like one. But the whole goal is to make the fat come out more effortlessly. So that creates less trauma for your body, and it's actually easier on the surgeon. I find that we see less contour regularities because this, in some extent, liquefies the fat to a degree and allows it to come out a lot smoother, and we have way less contour regularities and overall better contouring. So every case I use the Vaser. This is the device I use to remove fat. This is a power assisted micro air or liposuction, and it has small little vibrations that kind of take a lot of the pressure and strain off the surgeon's hands, but it also makes it easier to move through the tissues. So I've already used Vaser, which makes it easier for me, and now I have this as well. And so I always have a curve in my cannula, and this helps me stay away from the vital organs and bones and structures that are below the fat, and that's what keeps liposuction safe. Other than that, this is a very small, narrow diameter with just a few holes that remove the fat. I don't like to use bigger, aggressive cannulas because that tends to cause more contour regularities. When you see irregularities like fibrosis or the kind of that cobblestone abdomen, it's not from lack of massages. It's typically from uneven or irregular liposuction. When we're doing lipo, we never remove all the fat, or at least I don't, because that's where you end up with a lot of contour regularities. And so the goal with liposuction is when you're looking at the stomach, yourself or anyone else, it should still have smooth contours. And the way we do that is, just imagine that this is the skin and fat. So just imagine that the skin is here and we have fat below. There's always a superficial layer of fat and there's always a deep layer of fat. When we do lipo, the goal is to remove this deep layer of fat and leave the superficial there, and that way it still looks nice and smooth. We can take a little bit of the superficial fat, but we only take it really deep. So we always clear out the deepest fat and leave a nice little bit underneath the skin. Now, when we're doing high definition, that is when we aggressively take some of the superficial fat because we're looking for those contours in those valleys. So the key to good lipo, lipo deep, leave the superficial fat in place. So people ask, how do you make sure you don't lose too much blood during liposuction? Well, as you know, we always get pre-op labs, but one unique thing that we do here at APM Plastic Surgery is we always check your hemoglobin on the day of surgery. Because you may have gotten your labs and you had a really high hemoglobin, but if you recently had your menstrual cycle, then your hemoglobin may be actually lower. So we actually know exactly how much blood you lose with every liter of fat that we take out. And so using those calculations, that actually tells us what is safe and how much fat we can actually remove. So what if your hemoglobin is low before surgery or you have low iron levels? Well, we always encourage you to get your labs checked about a month and a half before surgery. And we always put you on some sort of iron supplementation. Oftentimes you may have a B12 deficiency or a folate deficiency. Our nurse who checks our labs along with me actually administers a lot of these vitamins either intramuscular injection or through an IV. it's very common for us to give iron infusions to people who want to get their hemoglobin up before surgery. The higher your iron levels are, the safer it is to take out a higher volume of fat during liposuction. In plastic surgery in general, sterility is key, and especially when you're doing a BBL, we don't want to deal with infections, we don't want to deal with any bacteria, and so prepping the field widely with a good solution is extremely important for the safety and sterility of these cases. I'm often asked why I don't do awake lipo. I'm not opposed to it for small areas or for little touch-ups or revisions, but in general I find that when the patient's asleep, comfortable under general anesthesia, which is extremely safe, I'm able to be more aggressive with the amount of fat I remove, and I'm able to give a better sculpted BBL. Now, there are lots of surgeons who do awake lipo and get excellent results, but in my hands, for the results I get, I need you to be all the way asleep, general anesthesia, for maximal safety and efficiency. So I finished with the arm lipo, and after surgery you always drain a little bit of fluid. So as you see, as I kind of massage this arm here, some of that extra fluid from lipo comes out. And we always like to leave these incisions open so you don't get fluid buildup or seroma. And so that's why it's very important post-op to get your incisional drainage massages to help get that fluid out. In addition, massages help to activate your lymphatic system. So your masseuse should be trained in these techniques. And by activating a lot of the lymph nodes, especially underneath the arm, that helps your body absorb a lot of that extra fluid that your body is stuck with after liposuction. So it's extremely important to get massages on all the areas you had lipo. You never need massages on the actual BBL or any fat transfer area itself. So one way to ensure that we keep infections out of the fat and to keep a sterile environment is everything's in a closed system canister. So I don't remove the fat and put it in syringes and inject it. I keep it all in this canister, and the fat is then pumped out through a tubing and through my liposuction handpiece and into the buttocks. And so that's how I keep a nice closed sterile environment without touching the fat or contaminating it or exposing it to the air. All right, so when I do a BBL, I use ultrasound. The reason for the ultrasound is I can see exactly where I'm placing the fat, and it helps me stay out of the muscle, so it's all for safety. So this is an ultrasound probe, and it transmits a signal through here and then onto the screen right here that I can see. So this is the patient's muscle right here, and this is the deep layer of fat and the superficial layer of fat. As I mentioned previously, when we're doing a lipo, our goal is to remove a lot of the deep fat from the abdomen and the back, and that helps leave a nice smooth layer for contours. For BBLs, our goal is to avoid any muscle injection because that's dangerous. That's where you can get into large veins. And so by using ultrasound, it makes sure I know exactly where I'm at, and that's in this deep fat layer. Sometimes I put a little bit in the superficial, but mostly in the deep layer, and that's how we stay safe. So now that the fat is in, I'm doing an ultrasound to kind of show you what we're looking at. So this layer here is where the fat was put in. Here below this white line, that's the muscle. So this middle layer has expanded, and that's what's going to give you that nice projection. The muscle has been untouched. There's no fat injected in the muscle. All the fat is above the muscle, and the deep layer, the superficial layer, has been untouched. That's why you don't really see a big lumpy BBL after I'm done, but all the fat is deep and the muscle layer untouched. So that's the Dre Sculpt ultrasound-guided safe BBL. So what does BBL recovery look like? Well, I think the hardest part is there's no sitting. So we don't want you putting pressure on that newly grafted fat, otherwise you cut off the circulation. And a lot of that new fat needs oxygen to survive. So no sitting. If you're sleeping, you want to be laying on your stomach. You can also kneel, but the more pressure you keep off your butt, the better. We also like you not to use the BBL pillow. The less you use that, the better. If you need to drive, if you need for work, you have to use it. But the less you use it, the better your results. So what small adjustments made a huge difference in this case? For her, she was a very petite patient, so I would say adding the arm liposuction was crucial. One, it's going to help her frame that's already athletic look a little bit more toned. In addition, I was able to get about 600 more cc's of fat, which was used to help create fullness to her hips and buttocks. And so adding the arm lipo for her was one of the best decisions for this case. So what's a common misunderstanding about BBL outcomes? That's a great question. So I think one of the most common misunderstandings is what you initially see on post-op day 1 or 2 is not your final result. Your butt is often very hard, very firm, and the butt often looks misshapen. Your body takes time to settle. A lot of the fat and swelling has to go down, and that's when you see your final result. The skin has to stretch, kind of that fluffing phase that everyone talks about. That's basically when the skin has relaxed to its maximal potential and the butt becomes soft and jiggly like it was before your surgery. Another misperception is when you first see it and it looks really large, that's your final result. That's far from your final result. It's no different than if a boxer gets punched in the face, his eye swells. Well, with liposuction and a BBL, your whole body swells. And so first you gotta remember that swelling goes away. That may take you 1 to 2 months for a lot of that swelling. And then you resorb some of that fat, upwards of 30%, sometimes even more. So how do you maximize how much fat you keep? Well, you need a very healthy, nutritious diet. Don't lose weight. Make sure you're getting your post-operative massages and continue to wear your garment around the clock. If you do those things and avoid putting pressure on the butt by sitting or sleeping on your butt, you'll keep a lot of that good fat that we harvested and placed in your hips and your butt. So the case is all done. Lipo 400, lipo the arms, and BBL. So if you can see from the side here, you can see she now has really, really good projection. That's like just my signature. That's what I like to do in patients who are looking for that more of a rounded look. I achieved that by doing lipo contouring to the entire back, especially the lower back, and that helps obtain more of this rounded, projected buttocks. Fat was placed in the hips and the buttocks itself to help project, and as you can see, this was done under ultrasound guidance for safety. Dre Sculpt, Lipo 400, BBL.